Okay, so let's talk about what happens in the pre-op stage of OR nursing. First, we start with the emotional aspects of the surgery overall. We make sure that you have a support system when you go home. We make sure that you have an understanding of what you're having done in your own words. We assess things that can complicate surgery or anesthesia. So we're asking you questions about your age, your weight, your height, if you've had anesthesia before in the past, or if you're taking any kinds of medications or supplements. Then we do the stop bang. So we talk about your snoring, we talk about your tiredness. We ask, have you ever been told that you have sleep apnea? And then we also discuss your blood pressure as well. Then we go to the bang aspect. That's going to be your BMI. Then we have your age, your neck circumference, and then also your gender. This is like a pre-prep for anesthesia before they come and see you so that they know if there may be any risk during the anesthesia process. Then we'll take an in-depth look on your medication. So that could be daily medications, that could be if you take aspirin, that could be if you're on an antidepressant, that could be if you're taking something for seizures. It could be a wide range of things, but it could also be things like taking garlic, or a big one could be like St. John's worts. All these things can affect healing and also bleeding. We also discuss why the surgery is being done. This could be diagnostic, it could be exploratory, it could be reconstructive, it could be constructive, it could be cosmetic as well. From there, we classify the surgery. So that could be major or minor, it could be emergent, non-emergent, or elective. It helps prioritize care because an emergency appendectomy looks different than an elective knee replacement. Then we're hitting our checklist. So that's going to be whether you've had something to eat or drink today. If your case requires a bowel prep, that means that you are using the bathroom until you run clear. So that's another question, but that's not for all procedures. Definitely make sure we go over any allergies or any lab concerns that we may have. At this point, we'll also start IVs, give you any antibiotics that are ordered, or any fluid. Hoping that you don't have any nail polish on, remove your jewelry, no glasses, no contacts, no dentures. Then we're going to ask you if you have any non-removable metal in your body or any tattoos. Sometimes tattoos have metal in them and it can affect the system that we use when we're using cautery. So we'll ask any knee replacement, hip replacement, anything like that. You may get asked 100 questions by 100 different people, and it's always going to be the same questions, but it's in the call of patient safety for you because we want to make sure that we're going over the fact that you haven't had any allergies to any medications, foods, anything like that that can affect your surgery, or if you've eaten or drinking anything. We want to make sure that we're also educating and making sure that you understand the risk and the consents that you're signing. And also, this is where you would speak to the surgeon, the anesthesiologist, the OR nurse, pre-op nurse, if there is a pre-op team in your department. You would be educated on going to PACU or back to an inpatient unit once we're done with the procedure. We also want to make sure that we're respecting any health beliefs that you have, so we'll also be asking around that time. Also, at this time is when we would be pre-prepping your skin. Hopefully the night before you shower with the chlorhexidine wash, or you wipe off with the wipes that we give you, but we'll also make sure we double and triple check and clean you, essentially because you'll get pre-prepped in pre-op, and then you'll also get prepped when you're back in the OR. At this point, this is where you would be getting site marked by the surgeon, and you're making sure that the area that they're marking is exactly where you're having your procedure done. And that's the pre-op process in a nutshell. It's prepping your mind, your body, and educating you on what you're about to have done. It's giving you the chance to understand that we're setting a safe tone for you while you're getting your procedure done. If you have any more questions about the pre-op process, go ahead and follow me, like, comment. I definitely will respond.